Did you know that May is Mental Health Awareness Month? And this month, May 2020, you, along with millions of other people around the globe, may be experiencing more mental health difficulties than usual. I'm Elisa Hayes. I'm showing up, no makeup, just as is, to talk about mental health awareness and break the stigma. People refer to me as being inspiring. It's a word I have the honor of hearing a lot, and they think that I'm a positive thinker. I am, but I'm also not. I have mental health conditions that make life really hard sometimes. And to be a part of breaking the stigma, I want to just share a little bit about that. I talk about leaders being vulnerable, being authentic, being real. And if I'm going to walk the talk, then I should be authentic and real, but that doesn't make every conversation a counseling session. As we know, with COVID-19, there's been an enormous level of added stresses and depression, anxiety. Mental health issues are hugely on the rise. I have a few extra bonuses that I get to add to layer on top of what so many people feel of stress, isolation, or just a lot of family togetherness. Thankfully, I like my family, so that works out pretty well. But I have PTSD from major trauma. I don't think that's a big surprise to anyone. And I also have a traumatic brain injury that I don't talk about much, and most people don't think about it much. It'll come out in a story where I will say I had to relearn everything. I had to relearn how to read, how to cook food. But what I don't talk about is the memory troubles, the difficulty finding my words a lot of times, which is why I do that. I go, because I'm trying to think. I don't talk about the anxiety, the sadness. So if you are struggling with mental stability, emotional stability during this COVID-19, I want you to know that you're not alone. Any photos that you see of me with big, beaming, bright smiles, those are real, but I don't look like everybody else on social media. I don't look like that all the time. Some days I look like this. Some days I have massive panic attacks. Just Tuesday, this week, 2 days ago, I had a huge PTSD reaction, as I sometimes will have, where I will all over, full body shaking uncontrollably. My youngest daughter got a weighted blanket and wrapped it around me and trying to calm my body down, even though my brain is actually quite clear. I wasn't sad or upset. I just have a problem where my brain feels like it's fighting to stay alive all the time. And certain things will trigger that and make it into a more acute, what my therapist calls an acute phase. And yes, I have a therapist, as anybody should have professional help if you can get it. If you need it, get it. Absolutely. And when I'm in an acute phase, my brain, my baby lizard brain, the amygdala, is convinced that I'm fighting to stay alive, because I've actually had to fight to stay alive. And all of the news around COVID-19 and social media posts, sometimes the way people speak what I perceive as cavalierly about things, feels like a direct threat to my life. At least that's how my brain interprets it. And it will show up with me being wildly incapable of functioning. Today I went to the hospital to have blood drawn for the first time since mid-December. I'm supposed to go every 3 months because of my transplanted kidney. And I needed to go to the valet parking because I can't walk the distance from the further away parking lot, but all of the close-up spots are full, so they have valets for that, which is great, except none of the valets were wearing gloves, and the only masks that they were wearing were tucked below their chins. And a valet walked up to my open window right on the other side of the door with no mask or gloves. And I said, I take immunosuppressive medications because of a kidney transplant. I can't have anyone in my vehicle without a mask and gloves. And he said they had steering wheel covers and gear shift covers. Nothing to deal with the fact that they handle your keys, your door handles, everything. But I had to give him my car, or I wouldn't be able to have my blood drawn, and I needed to do that so that I could see my kidney doctor through a telehealth appointment. I handed him the keys. I walked into the lab, said hi to Michelle, the lab technician, who I've seen for, oh my gosh, well, since I got out of the hospital. So, coming up on 6 years, I guess. And she was incredibly kind. I went lightheaded, started to cry, started to shake, having a reaction of feeling under threat, because, as you can imagine, under COVID-19, I feel under threat all the time. And I have flashbacks of being on life support machines. Which, if you've never spent time on a ventilator, for the record, it really sucks. It's awful. And I remember it all very well, unfortunately. I can have trouble remembering what I'm trying to say in the next 2 minutes, but I can remember that. So I want to encourage you, as you are coping with COVID-19, to give yourself grace, to give yourself gentleness, whether you are working more than you ever have because things are crazy, or you're not working at all because things are crazy. Don't let it make you crazy. Don't feel like you need to show up social media perfect all the time. Don't feel like you should be better. Just recognize that how you are right now is okay. You're okay. and you can be honest about how you are. Break the stigma.